No mai, haere mai. Welcome to 3 News. Well, a group of female ex-MPs from the left and right of politics have taken the government to task over the way it hurried through changes to pay equity reforms last year. The changes saved the government nearly $13 billion, but they meant many female-dominated industries had their pay equity claims scrapped overnight. The People's Select Committee called it a flagrant and significant abuse of power, which amounted to orchestrated subterfuge. Senior political correspondent Jenna Lynch has the details.
In the absence of any way for the people to have their say, this group of former MPs held their own select committee into pay equity changes, which were passed under urgency last year.
Submitters were very blunt about the process the government used. No warning, no consultation, no select committee, no regulatory impact statement, no evidence.
Let's be clear, this government didn't just move the goalposts, it took them right off the paddock.
Orchestrated subterfuge was how it was described. We agree.
The group, who served in National, Labour, New Zealand First and the Greens, found the passing of the Act was a flagrant and significant abuse of power.
It undermined, or rather it destroyed trust and confidence in government and in the concept of negotiating in good faith.
In analysing the Cabinet papers, they found serious gaps in the evidence behind the policy, including no evidence that any minister ever sought detailed advice on human rights.
The committee found the government knowingly and willfully breached its international legal commitments under treaties on discrimination against women.
Nobody did the economic cost-benefit analysis on this.
They also found the use of urgency had not been due to an emergency, but to avoid public scrutiny. It was labelled anti-democratic.
The ram raid no one was expecting.
The committee heard from rural women concerned about their midwives and health staff.
We were told by a rural organisation that pay equity isn't an abstract principle, it's about whether our essential services can survive. The government calls it a reset. Rural communities know the truth. It is abandonment.
From high schoolers who said the cost of training for these professions wasn't worth it anymore.
They've been put off any training as a social worker or any woman-dominated profession because it was never going to pay them properly. It was as simple as that.
Pacifica women bear the brunt of inequity. For every dollar a Pākehā man earns, a Pacifica woman earns 75 cents.
Amounting to $500,000 over a lifetime of work. These aren't just numbers. So convert them. Their school uniforms unpaid, rent overdue, and dreams deferred.
The hurt among women in these professions is palpable. Fiona McDougall had her retirement plans upended.
It's altered my feeling about the whole of my nursing career, because you think, you know it's a job that's not very well paid, but just to have that hope dangled in front of you and then taken away at the last moment was really disappointing.
Anna Garton is a hospice nurse and solo mum struggling to make ends meet.
I'm really having to prioritise what is necessary, but it's really hard to say to a child when you're working really hard. At the moment I work 2 jobs to make ends meet. I have to tell him no, there are some things that I cannot provide for him.
These care and support workers had a message for the Finance and Workplace Relations Ministers.
What would you like to say to them?
And to be honest, when you get to the point and you need care, I hope you don't get it.
Former National MPs urging women not to stop fighting.
Don't be defeated, that's what they want. Yeah. All right, that's their most important thing, is to make you feel powerless and to feel defeated. Defy them.
Women and affected families will vote accordingly. So it is an election issue and they need to front up about it.
But given the response from the government today...
And will you read the People's Committee report into the pay equity change? Will you read the People's Committee?
I'm sure I will in due course, yeah. A group of people who have self-appointed themselves as an authority may expect everybody to jump to their tune. Sorry if they're not.
The Coalition clearly has selective hearing when it comes to listening to the public.
And Jenna, in other news, the Prime Minister has expressed concern about a major data breach of another medical platform. What's happened?
Yeah, this is still a very much a developing story, but it relates to Medimap, which is widely used across the healthcare sector for pharmacy dispensing, prescribing and medication administration. So it's used by pharmacies, GPs, hospices, disability services, aged care, and it's been hacked. So someone has got into the system and changed patient details, including changing the status of some patients from alive to dead and changing the names of some patients, including to Charlie Kirk, the activist, the Conservative activist who was shot dead in America last year. Now, staff at some of the facilities have come forward to tell us that they started panicking as soon as this happened because the hack had left them uncertain as to which medications to give to which patients. These are patients who need heart meds, diabetes meds, blood pressure meds, so it's pretty serious stuff. No one seems to have a handle on how widespread it is, but the publicly available information suggests it's used by 2,000 GPs, over 340 facilities, more than 350 pharmacies, so the patient numbers have to be climbing into the thousands, if not tens of thousands. The company says as soon as they became aware of the issue, they engaged specialist external cyber experts and placed the platform into maintenance mode as a precautionary measure to protect patient safety.